to our next lesson of anatomy as it relates to lower back pain here in our Lower Back Secrets program. And this is the lesson dedicated to muscles. We've talked about bones, we've talked about the discs, the herniated discs, and now we're going to talk about what muscles are related to lower back pain, both in the context perhaps of what muscles are responsible for certain issues with lower back pain, but then also perhaps what muscles are you feeling when you feel pain in certain situations. Okay, so let's get started and let's talk about some muscle groups. One of the things you're going to be learning very soon is about pelvic rotation, okay, and how pelvic rotation is kind of the key to whether or not you're putting stress or strain into the lower back. Well, pelvic rotation is going to be completely determined by hamstring. So let's talk about the hamstrings first, okay? So your hamstrings, you have three hamstrings. When you look at an anatomy book and you see how they lay out the hamstrings, they're going to give the hamstrings three different names for three different individual muscles. Okay, technically speaking, we're talking about semi-membranosus, which means it's like a membrane, semi-tendinosus, which means it's like a tendon, and then biceps femoris, which is those make up your three muscles that are called hamstrings in English. Ischiotibialis if you're in the Spanish-speaking world. Your hamstrings are all starting down here. Let's see how far we can see. Good. Perfect. Down here below the knee. So below the knee, attaching onto the tibia in some cases, or the fibula in other cases, behind the knee, and then rising up the back of your leg. Okay, so hamstrings are going to start here, behind your leg, rise up the back, okay, and then they're going to attach directly to your sitting bones down here, okay? So the first group we're talking about is your hamstrings group, and this is of course the pelvis, and this is of course the bottom, and the hamstrings are coming up from below and they're grabbing right onto the bottom of your pelvis. Okay, something that we're going to be looking at again as we discuss pelvic rotation. Okay, but in this context, we're really just talking about the muscle groups themselves. So we have the hamstrings group, and then kind of up along your spine here, okay, is a group of muscles called erector spinae. And the erector spinae group is the group that is structurally keeping your spine straight. They're vertical muscles that run up and down your spine, and you know, you can feel pain here, okay? Many people do. This is not one of the sources of the profound back pain. This is not a herniated disc. This is not a sacroiliac thing, but this is certainly something that can reflect pain for someone who does have one of those specific situations. And then you have another muscle coming out here to the side called quadratus lumborum. Quadratus lumborum, it's not technically a muscle that I consider to be in this kingdom of lower back pain, but it's certainly out there in the region, and you could easily be experiencing painful muscles there. Okay, our system will certainly help that. And then one more little muscle here, very important for people that are experiencing sciatica pain. You know, essentially feels like pain in the butt, but we're talking about, of course, about pain, you know, in the region behind your pelvis here, and then shooting down the leg. And that's a muscle called piriformis. And piriformis is connecting your sacrum to the outside of your femur. So you got some muscles here, and this is just kind of so that when someone tells you about some part of your body and they start using muscle names, so that you're not going to say, oh, well, what is that? What is semitendinosus? What, you know, well, that sounds so, you know, advanced in knowledge. Well, okay, this is just anatomy. These are just muscle names, and it's good to learn them. It's good to learn everything about this subject because you're going to learn here all the basics, but then you're going to learn how this relates to structural anatomy and then how all of this makes sense for what the Lower Back Secrets program is going to be delivering for you, which of course is a pain-free, drug-free, and no more surgery life. Okay, so as far as the muscles are concerned, we're going to leave it at that. Of course, you do have your gluteal muscles here. Your big butt muscles are called gluteus maximus. You have gluteus medius within there. You know, we've got some other muscles along the inside, but the most important one is piriformis. And then, of course, quadratus lumborum for some people that suffer from the side. Straight up the top is your erector spinae group, and your hamstring group is really the one most responsible for why you have back pain. And I know that sounds strange. I know that sounds strange, and you're suggesting, maybe we're thinking, well, how come it's the muscles in my leg that are responsible for my pain in my back? Well, that's something we're going to be talking about soon, but I want to just really emphasize that that's really exactly how it is. You might be feeling pain in the muscles of the back, but that's a reflection of what's happening as a result of the pelvic or lack of pelvic rotation, and that is a function of what's going on in the hamstrings. Okay? So all of it's going to come together. This, of course, was our muscles lesson, and talking about what muscles relate to lower back pain. And we're going to continue to develop this anatomy chapter and make it more and more clear about what the approach is going to be that is going to be successful and why it is successful. Okay? So you're on your way. You're learning a lot. Hope you're getting excited to continue with this and to realize that you are really, really going to be pain-free and really, really soon. See you at the next lesson.